The 7 essential vitamins for leg strength. Envision awakening each morning with legs that are robust, stable, and invigorated. Elimination of muscle weakness, cessation of severe cramping, and removal of concerns regarding balance or falls. To maintain activity, independence, and confidence, the key is in diet. Today, we are disclosing the 7 most potent vitamins and minerals that will maintain the strength and resilience of your legs. These important nutrients significantly enhance muscular performance, preserve bone density, and improve circulation, thereby impacting daily movement and overall well-being. This movie is for you if you enjoy walking in the park, dancing, or maintaining your independence. Before we commence, I would like to ascertain your location of participation today. Please leave a comment below and do not hesitate to pose any inquiries you may have. Additionally, ensure you subscribe and activate notifications to remain informed about the premier health advice from Elderly Wellness Hub. Let us together construct a more robust and healthy future. Initially, let us discuss vitamin D. With advancing age, our bodies experience unavoidable transformations. Muscle mass diminishes, bone density decreases, and motions that were previously uncomplicated may become progressively challenging. A frequently neglected factor contributing to this decline is a lack in vitamin D, which extends beyond only causing brittle bones. This vitamin is essential for maintaining strong, balanced, and functional legs. Let us explore the significance of vitamin D as the paramount nutrient for leg strength in the elderly and how maintaining sufficient levels can enhance mobility and general health. With advancing age, our skin's capacity to synthesize vitamin D from sunshine diminishes. Moreover, numerous seniors reduce their outside activities due to mobility constraints, lifestyle alterations, or apprehensions regarding skin harm. What is the outcome? A prevalent deficit that insidiously diminishes muscle strength, resulting in weakened and unsteady legs. Research has consistently demonstrated that insufficient vitamin D levels are directly associated with muscle weakness and a heightened risk of falls among the elderly. Research published in the Journal of Clinical Endocrinology and Metabolism indicates that seniors with adequate vitamin D levels have enhanced muscle fiber strength, superior coordination, and greater balance, hence reducing their susceptibility to accidents and fractures. In contrast, individuals with a deficiency encountered expedited muscle deterioration, rendering fundamental tasks such as ascending stairs or rising from a chair increasingly difficult. Vitamin D encompasses more than merely calcium absorption or skeletal health, although these aspects are very significant. This potent vitamin directly influences muscle function by augmenting protein synthesis and promoting neuromuscular transmission. Consider it a source of energy for your leg muscles. In its absence, they encounter difficulties in achieving optimal performance. Research indicates that vitamin D is essential for the preservation of fast-twitch muscle fibers, vital for rapid responses and balance. These fibers facilitate quick leg responses to prevent falls when equilibrium is jeopardized. Insufficient vitamin D results in the degeneration of muscle fibers, causing delayed reaction times, diminished muscle contractions, and an increased susceptibility to injury. Moreover, vitamin D has been shown to diminish inflammation in muscular tissues, mitigating persistent pain and discomfort frequently encountered by seniors in their legs. Individuals experiencing recurrent cramps, rigidity, or inexplicable leg discomfort may be astonished to discover that merely enhancing vitamin D levels might yield considerable alleviation. Neglecting vitamin D deficiency not only results in diminished leg strength but also predisposes individuals to several severe health issues. The most concerning? Osteoporosis and fractures. Inadequate vitamin D impedes calcium absorption, resulting in fragile bones that are prone to fractures. A simple misstep may escalate into a significant injury, severely impacting movement and autonomy. In addition to affecting bones and muscles, a deficit in vitamin D has been associated with heightened risks of cardiovascular disease, cognitive deterioration, and compromised immune function. Older adults who disregard their vitamin D consumption may experience weakened legs and an increased risk of chronic diseases that diminish their quality of life. What is the resolution? Optimizing vitamin D levels is straightforward and can produce transformative results. Here are the most efficacious methods to enhance vitamin D levels and maintain robust and stable legs. Solar irradiation. Exposing oneself to direct sunshine for 15 to 30 minutes, ideally in the morning or late afternoon, can yield a natural enhancement. Exposing your arms and legs enhances absorption. However, be cautious with sunscreen application, since it may inhibit vitamin D synthesis. Foods abundant in vitamin D. Although food alone may not suffice to fulfill daily requirements, the inclusion of fatty fish, such as salmon, mackerel, and sardines, along with fortified dairy, egg yolks, and mushrooms, might enhance overall consumption. Dietary supplements. For numerous elderly, particularly those who have restricted outside exposure, a vitamin D supplement is imperative. Experts generally advise a daily intake of 800 to 1000 IU for optimal bone and muscular health. However, individuals with significant deficiencies may require greater dosages under medical supervision. If you are uncertain about your vitamin D levels, a straightforward blood test might offer elucidation. Numerous physicians now systematically assess vitamin D deficiency in elderly individuals, acknowledging its vital function in reducing falls and fractures. Calcium. In contrast to younger individuals whose bones are actively rebuilding, seniors undergo a progressive decline in bone mass, rendering them more vulnerable to fractures. This poses a significant risk to the legs. Hip fractures, femoral fractures, and stress fractures in the lower extremities are some of the most severe injuries encountered by older persons. A slight fall that may have been innocuous in youth might lead to months of recuperation or perhaps permanent loss of mobility when bones are deficient in essential calcium reserves. Calcium's function extends beyond only fortifying bones. It is also an essential component in muscle contraction. All movements, including stepping and standing from a chair, depend on a sophisticated interaction between calcium ions and muscle fibers. Calcium serves as a catalyst for muscular contraction, facilitating smooth and regulated movement. Insufficient calcium may result in muscle cramps, weakness, or an inability to produce the necessary force for stability. This is why numerous persons with calcium shortage have recurrent leg cramps, diminished mobility, and overall decreased muscle endurance. How do you guarantee adequate calcium intake for your body? Dairy items such as milk, yogurt, and cheese are among the most abundant sources, although they are not the sole alternatives. Leafy greens, kale, bok choy, almonds, tofu, sardines, and fortified plant-based milks offer substantial calcium content. Diversity is vital. Integrating several calcium sources into your diet guarantees consistent absorption and enhanced bone health. Nonetheless, dietary calcium may prove inadequate, particularly for those with dietary limitations or absorption difficulties. Calcium supplements can be beneficial, especially when paired with vitamin D, which facilitates calcium absorption in the body. However, an increase is not invariably advantageous. Although calcium is vital, excessive consumption, especially from supplements, may result in arterial calcium deposits, renal stones, and gastrointestinal complications. Achieving the appropriate equilibrium is essential. The advised daily calcium intake for older persons is 1000 to 1200 milligrams, ideally derived from a mix of natural foods and supplements when required. In addition to consumption, another critical factor in the efficacy of calcium is physical activity. Weight-bearing workouts, including walking, resistance training, and mild jogging, promote bone remodeling and facilitate the deposition of calcium in the bones and muscles where it is most required. In the absence of movement, sufficient calcium consumption cannot entirely fortify the skeletal system. Disregarding calcium consumption not only compromises bone integrity, it deprives persons of the capacity for unrestricted movement, participation in cherished activities, and the preservation of autonomy. A life characterized by mobility, stability, and confidence is predicated on robust bones and efficient muscles, both of which rely on calcium. 3. Although discussions about leg strength often focus on calcium and protein, it is crucial to recognize that vitamin B12 is essential for neuromuscular function. It is accountable for maintaining nerve health, guaranteeing that the electrical impulses traversing your spinal cord and extending to your legs remain robust and accurate. In its absence, your muscles fail to receive appropriate signals, resulting in weakness, instability, and a gradual loss of motor control. A prevalent symptom of B12 deficiency is the sensation of heavy, fatigued legs, frequently accompanied by numbness or tingling. However, there exists a dilemma. Vitamin B12 insufficiency is alarmingly prevalent among elderly individuals. In contrast to other vitamins that can be retained in adipose tissue or assimilated from various food sources, the absorption of B12 is significantly contingent upon gastrointestinal health. The body necessitates sufficient stomach acid and a specific protein known as intrinsic factor to assimilate B12 from dietary sources. With advancing age, the production of stomach acid diminishes, and ailments such as gastritis, acid reflux, and prolonged antacid use can further hinder nutrient absorption. Moreover, numerous seniors inadvertently adhere to diets deficient in B12-rich foods, leading to a gradual yet consistent depletion of this vital component. The ramifications of B12 deficiency extend well beyond mere fatigue. Untreated B12 deficiency can result in permanent nerve damage, impairing balance, coordination, and reflexes. Numerous seniors experiencing recurrent falls, ambulation difficulties, or a perception that their legs are no longer functioning optimally are, in fact, encountering the neurological consequences of a vitamin B12 deficiency. The deterioration is frequently so incremental that it is seen as a typical aspect of aging. In actuality, it is completely preventable. Restoring B12 levels can significantly enhance mobility and energy levels. Research indicates that elderly individuals who rectify their deficiencies exhibit significant enhancements in strength, endurance, and lower limb functionality. Where is this essential vitamin sourced from? In contrast to numerous other nutrients sourced from plants, vitamin B12 is predominantly derived from animal products. Optimal sources comprise lean meats, fish, eggs, dairy products, and shellfish, notably clams and liver, which are among the most nutrient-dense options. Individuals adhering to plant-based diets or experiencing absorption difficulties find B12-fortified foods, such as cereals and plant-based milk, or B12 supplements, indispensable. The favorable information? Vitamin B12 is among the most secure vitamins for supplementation, as surplus quantities are eliminated by urine. Numerous older persons derive advantages from higher-dose B12 pills or intermittent injections, particularly if they experience challenges in absorbing it just from dietary sources. Consistent blood testing can facilitate the maintenance of optimum levels and avert the progressive deterioration of leg function commonly associated with insufficiency. However, the essential conclusion is as follows. Robust legs encompass more than mere physical power. They pertain to the efficiency of the neurological system, reaction time, and coordination. Regardless of the extent of your exercise regimen, if your nerves are not functioning properly, your legs will not respond as expected. Consequently, sustaining sufficient B12 levels is one of the most neglected yet potent techniques for preserving mobility and quality of life in aging individuals. 4. Magnesium. With each stride you take, magnesium functions discreetly, facilitating the transmission of impulses necessary for the smooth contraction and relaxation of your muscles. It serves as the principal regulator of muscular function, inhibiting spasms, diminishing tiredness, and enhancing endurance. A prevalent yet often unacknowledged manifestation of magnesium insufficiency is restless leg syndrome accompanied by recurrent nocturnal leg cramps. Numerous seniors encounter abrupt, painful muscular spasms in their legs, especially during the night, which disrupts sleep and complicates recovery from daily activity. This is not merely an inconvenience. It indicates that the body is having difficulty managing muscular relaxation effectively. Magnesium mitigates excessive nerve signals and prevents muscles from involuntarily contracting, rendering it vital for individuals experiencing muscle tension and spasms. However, magnesium's function extends beyond muscular activity. It is essential for bone density and joint health. Although calcium is frequently emphasized for its role in bone health, its efficacy is significantly dependent on magnesium. This mineral facilitates calcium transport and promotes its appropriate incorporation into bones, preventing deposition in soft tissues that may lead to stiffness and joint pain. Research indicates that increased magnesium consumption correlates with enhanced bone strength and a diminished incidence of fractures in older persons, rendering it a crucial element for general mobility. Magnesium shortage is prevalent mostly due to its susceptibility to depletion from stress, pharmaceuticals, and inadequate dietary practices. Numerous elderly individuals consume medications that diminish magnesium levels, such as diuretics, proton pump inhibitors, and certain antihypertensive agents. The combination of diets deficient in magnesium-rich foods leads to a pervasive shortage that gradually undermines strength, endurance, and flexibility. This explains why numerous elders undergo a progressive decline in stamina, resulting in shorter walking distances, slower stair climbing, and weariness following uncomplicated tasks. It is not solely age, it is also a deficiency of essential minerals necessary for optimal performance. Restoring magnesium levels can promptly enhance leg health, alleviating cramps, boosting energy, and facilitating smoother movement. Optimal dietary sources of magnesium encompass leafy greens, nuts, seeds, whole grains, and legumes. Foods such as pumpkin seeds, almonds, spinach, black beans, and avocados are notably abundant in magnesium, providing a natural means to support muscle and bone health. For individuals who find it challenging to obtain sufficient magnesium from their diet, magnesium supplements, particularly magnesium citrate or magnesium glycinate, might serve as an effective remedy due to their superior absorption by the body. The restoration of magnesium levels is amazing. Older adults who previously experienced lethargy discover that their legs exhibit revitalized vigor. Individuals experiencing recurrent muscle cramps or stiffness observe alleviation, facilitating improved sleep and enhanced mobility. Balance and coordination enhance. Since magnesium facilitates the regulation of neuromuscular connections essential for stable movement. 5. Potassium. Envision awakening in the morning, exiting your bed, and experiencing an instantaneous tightness in your calf. Does this resonate with you? Muscle cramps are a prevalent manifestation of hypokalemia. Potassium serves as a crucial regulator of muscle function, facilitating the equilibrium of fluids within and outside muscle cells. When potassium levels decrease excessively, muscles tighten involuntarily, resulting in unpleasant cramps, particularly in the legs. For older persons with diminished circulation or muscular mass, these cramps can be more than a mere inconvenience, they can be incapacitating. However, muscle cramps are merely the initial symptom. Have you ever experienced tremors in your legs after prolonged standing? Perhaps you have seen heightened rigidity while ambulating? Potassium facilitates the transmission of impulses between neurons and muscles, ensuring coordinated and controlled actions. Low levels impair communication between the brain and leg muscles, resulting in shakiness, weakness, or trouble in lifting the feet, hence greatly elevating the risk of falls. For elders, preventing falls is essential. In addition to its function in muscle physiology, potassium significantly contributes to the preservation of robust bone structure. It assists in neutralizing bodily acids that may deteriorate bone density over time. Research indicates that a potassium-abundant diet may decelerate bone loss, hence diminishing the risk of osteoporosis and maintaining the structural integrity of the legs. Potassium is essential not only for muscular activity but also for the harmonious interaction between the muscles and bones in the legs. How can you guarantee adequate potassium intake to maintain your legs? Fortunately, nature has bestowed upon us a plethora of delectable, potassium-laden foods. While bananas may initially spring to mind, they are merely the starting point. Sweet potatoes, avocados, spinach, beans, and oranges are all exceptional providers of potassium. A basic cooked potato with its skin might yield a higher potassium content than a banana. It is essential to integrate a diverse array of these items into your daily diet to ensure your muscles and bones receive continual sustenance. For individuals who find it challenging to obtain sufficient potassium from dietary sources, supplements may appear to be a convenient solution. What is the requisite amount of potassium for optimal health? The advised daily consumption for adults is 2,600 mg for females and 3,400 mg for males. This quantity is generally attainable by a well-balanced diet abundant in fruits, vegetables, and legumes. Individuals with health issues that influence potassium levels, such as renal illness or hypertension, should meticulously monitor their consumption and collaborate with a physician to ascertain the appropriate amount. 6. Vitamin K is frequently overshadowed by calcium and vitamin D when discussing vitamins crucial for robust bone health. However, in the absence of vitamin K, these nutrients cannot function effectively. Vitamin K is essential for directing calcium to bones, preventing its accumulation in arteries or soft tissues, which can result in stiffness, inadequate circulation, and cardiovascular disease. Vitamin K functions as a regulatory agent, directing calcium to appropriate locations and maintaining the structural integrity and mobility of the legs. This is particularly vital for older folks. Research indicates that those with elevated vitamin K consumption possess stronger bones, reduced fracture risk, and superior overall bone health relative to those with diminished levels. Vitamin K stimulates osteocalcin, a protein that binds calcium to the bone matrix, hence enhancing bone density and resistance to fractures. However, the function of vitamin K extends beyond that. It is a crucial ingredient for joint health and muscular function. Numerous individuals neglect the reality that healthy legs necessitate not just robust bones but also supple joints and efficiently operating muscles. Vitamin K has demonstrated efficacy in diminishing joint inflammation, perhaps decelerating the advancement of osteoarthritis and mitigating knee stiffness, a prevalent issue among the elderly. If your knees experience pain during movement or stiffness after prolonged sitting, vitamin K may be the essential component that alleviates discomfort and promotes mobility. Impaired balance, gait difficulties, and an elevated risk of falls are frequently associated with diminished leg musculature. Recent studies indicate that vitamin K contributes to muscle strength and coordination, especially in older persons. It achieves this by modulating calcium concentrations within muscle cells, facilitating appropriate contractions, and averting uncoordinated motions that may result in instability. Spinach, kale, Swiss chard, collard greens, and Brussels sprouts are among the most abundant sources of vitamin K1, the predominant type found in plants. Conversely, another potent variant of the vitamin, vitamin K2, is present in fermented foods such as natto, aged cheeses, and specific animal products including egg yolks and liver. K2 is especially advantageous as it is active in the body for an extended duration and significantly influences the transportation of calcium into bones rather than arteries. To naturally enhance your vitamin K levels, the most effective approach is to augment your consumption of green vegetables and fermented foods. Incorporating a daily amount of kale into a smoothie or adding a side of sautéed spinach to your meal can significantly impact your nutrition. For individuals who struggle to absorb vitamin K from dietary sources, particularly those with digestive issues or undergoing prolonged antibiotic treatment, supplementation may be advisable. However, vigilance is key. Consult a healthcare practitioner prior to increasing your vitamin K consumption if you are on anticoagulant medication such as warfarin, as vitamin K is vital to blood coagulation and may interfere with these drugs. 7. Vitamin B6, or pyridoxine, significantly influences leg strength and muscular function more than is commonly acknowledged. Numerous nutrients facilitate movement, although B6 is crucial for preserving nerve function, aiding muscle repair, and ensuring the body efficiently employs protein to develop and sustain muscular mass. In its absence, even the most robust muscles may deteriorate over time, rendering basic actions, such as rising from a chair or ascending stairs, excessively taxing. A frequently neglected component of vitamin B6 is its association with nerve signaling and coordination. Low B6 levels can result in slow or misdirected signals, causing numbness, tingling feelings, and unsteady gait. Numerous older persons erroneously attribute these symptoms to age-related muscle degeneration when, in fact, their bodies merely lack the essential nutrients required for optimal neuromuscular function. Another essential function of vitamin B6 is its role in mitigating inflammation-induced muscular tiredness. B6 aids in the regulation of inflammatory responses within the body, alleviating muscle soreness and enhancing the flexibility and resilience of the legs. Should you encounter ongoing stiffness or prolonged recuperation post-activity, augmenting your vitamin B6 consumption could prove beneficial. In addition to its role in muscle function, vitamin B6 is essential for the synthesis of red blood cells. These cells facilitate the passage of oxygen throughout the body, energizing muscles and ensuring they possess the endurance required for prolonged activity. A deficit in vitamin B6 can result in decreased hemoglobin levels, leading to insufficient oxygen supply to the muscles, which may cause premature weariness, heaviness, and diminished stamina. If you have experienced excessive fatigue during brief walks or minimal effort, it may indicate your body's want for additional vitamin B6. What is the source of this vital vitamin? Fortunately, B6 is plentiful in numerous palatable and readily available foods. Poultry, fish including salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals are exceptional sources. Integrating these nutrients into regular meals helps naturally restore your B6 levels, so enhancing nerve function and muscle power. Individuals with digestive disorders, inadequate vitamin absorption, or dietary limitations may require B6 supplementation to attain optimal levels. The advised daily consumption of vitamin B6 differs by age and gender, with older females generally requiring approximately 1.5 mg per day and older males approximately 1.7 mg per day. Although acquiring B6 from food is typically safe, excessive use via high-dose supplements warrants caution, as prolonged overuse may result in nerve damage. The optimal technique is to concentrate on a balanced diet abundant in B6 sources, guaranteeing a consistent supply without superfluous hazards. If you found this video beneficial, kindly remember to click the like button. It significantly aids us in delivering more valuable material to you. Please leave a comment below to share your opinions, inquiries, or suggestions for future topics to address. We appreciate your feedback. Certainly, click the subscribe button and activate notifications to ensure you do not miss our latest health advice and insights. Remain informed, maintain your health, and we shall see you in the subsequent video.